What's up, guys? Welcome to my next video. So it's officially week 10 from my labrum tear surgery on my left shoulder. So I didn't do a week 9 because week 9 and week 10, they're kind of the same. So I think I'm just gonna do a video every 2 weeks from now. So range of motion. It's gotten better. It's gotten a lot better. The pain is significantly reduced, but don't get me wrong, I still feel pain. My range of motion is great right now, but I still feel pain. But it's not crazy pain. It's just an insignificant amount of pain. If I put my arm back like this still hurts. So I'm still stretching this position. For the most part, this is good. This is good. That's really good. And honestly, I'm not a professional athlete, so it doesn't matter if I'm not 100% in regards to my range of motion. As long as as long as I'm close, I'll take 95%. I'm not too worried about that. So I've been doing physical therapy for about 5 weeks, and after 4 weeks, the first 4 weeks was for range of motion exercises, and they told me, all right, from now we're gonna focus more on strengthening. And from what I took from that in general is I do more back exercises rather than front exercises. So not too much push-ups, not too much bench presses, but more back exercises. The reason for that is because I have my tear in the front over here, and they want to make me do back exercises too. So my shoulders aren't rounded forward. They're more tight, pulled back. They want my shoulders back because having this forward motion weakens the labrum in the front. So they want me to do a lot of rowing exercises like this, to pull my shoulders back. And this explains a lot because when I was younger, maybe 11, 12 years ago, I worked out a lot, and I did so much push-ups and dumbbell flies. And I focused so much on my front that I didn't really focus on my back because I was young. I didn't have money, I didn't have money for a gym. All I had was dumbbells. So, there's really not much you can do with dumbbells for your back, but you could do a lot for your front. You could do dumbbell flies. You could do curls. You could do flies. You could do push-ups. You could do a lot of stuff for your front, but not too much for your back. And anyways, you live and you learn. So starting now, I adapt this rule, this 2 to 1 rule. So for every time I work out my front, I have to do 2 back exercises. So in other words, if I work out my front, work out the back twice as hard. That way my back will always be stronger than my front, and I don't have this rounded shoulder posture that I pretty much had my entire almost my entire life, starting from when I started working out, which was about 12, 13 years ago. Anyway, so this might not be the best thing to say, but I've kind of stopped going to physical therapy after 5 weeks because I feel like I kind of don't need anymore. My range of motion is pretty decent. I'm happy with my range of motions, other than this stretch that I'm continuing to work on. And also my physical therapist said where I'm gonna start focusing on strengthening now and stability. And I feel I could do that at home or go to the gym and do it. So that's what I've been doing for the past week and a half. I've been going to the gym every other day, and I've been working a lot on my rows, keeping my back strong. I did a few curls, and I've been doing some wall push-ups where I'll go in front of a wall and I'll just do push-ups, pushing against the wall, and I'm trying not to just instantly start doing a floor horizontal push-ups. My plan is to slowly decrease my angle or increase your angle, whatever you want to call it. But I want to start slowly going vertically. That way it's not too hard on my shoulder. I don't want to hurt anything. So that's very important. In the gym, I'm just using very, very light weights. I started last week with maybe like 5 pounds, and this week I've been doing 10-pound weights for dumbbell curls. So I've been doing lateral raises for my shoulder, but again, very, very lightweight, very low reps. Just take it easy. Be patient. You know, your body needs time to heal still, and you'll get there eventually. So you just gotta be patient. You don't want to hurt yourself again, and then redo this whole surgery. It's, you know, honestly, it's been this past 10 weeks was pretty rough. Thank God it's been getting easier now that I kind of hit the home stretch. So yeah, I don't think mentally or physically I could take another one of these surgeries. They're really brutal. The recovery is not fun at all. It's really tough. I've been really down during certain weeks, especially when there's pain. There's so much pain and you can't move. Everyone's going to the gym. You can't go to the gym. You can't even like open a cabinet because that hurts. You can't even do like this because it hurts. You know. So speaking of pain, I still feel a little bit of pain, but it's very insignificant. I feel pain it's kind of weird, hard to explain, but if I move my arm at a certain angle, very specific, like for example, if I go like this, I feel no pain, but if I go like this and maybe this way, I feel a little bit of pain. So again, the pain isn't too bad at this point compared to the previous weeks, compared to the earlier weeks. If I sleep on my left shoulder the whole night and I wake up in the morning, when I wake up in the morning, it will hurt. My left shoulder will hurt, a decent amount of pain, but I just go like this for maybe like 10 seconds and the pain goes away relatively quick. So maybe like in 20 seconds, the pain will go away, which is good. It's good. It's bad and good because because it hurts, but good because the pain goes away relatively quick. What else? Again, I'm not a physical therapist. I'm not an expert. I'm just letting you know what I'm doing, and so I would highly recommend you listen and do what your physical therapist says, because everyone's injury is different, everyone's recovery is different, everyone's body is different. You know, what works for me might not work for you, and yeah, and I'm trying to work. So what my typical workout so far for the past maybe 10 days is, the first thing will be I'll hit the treadmill. I do a light run, a 1 mile run, maybe at 7-minute, 30-second pace or 8-minute pace, depending how I feel that day, and you know, just loosen up my body. And for my biceps, I'll just do very lightweight 10 pounds curls, maybe just like 10 reps and 5 sets, very, very light. You know, I still need time to recover. I don't want to push it. I want to do it gradually as possible. Maybe 2-pound increases every week. So based on that math, and maybe in like 5 weeks or 4 weeks, I'll increase it to like, I could probably use 20-pound dumbbells. So you know, that's good. For the most part, once you're at 10 weeks, it's not as bad as, let's say, week 6. So that's great. Yeah. So right now my body's still kind of flabby. You know, I gotta work on my diet, but I'm not sure you could tell. You know, I'm getting a little bit back compared to my previous weeks. You know, getting a little slightly more cut. You know, I'm not too bad. It's not too bad, but it does suck when you're using such light weights. I know everyone else is using heavy weights. you see like a girl that's smaller than me. She's like curling 15 pounds, and I'm on like 5 or 10 pounds, and she's looking at me like, are you gonna? Do you really need? Do you need heavier weights? You know, it's just funny. But I'm not too worried so far. For the most part, when I work out, I don't feel too much pain. It's just it's more fatigue pain, kind of like sore, like a soreness. For example, let's say you throw a baseball for an hour and your arm kind of gets worn out. That's what it feels like. It's not really pain. It's just more like tired. The joints are tired. So after a workout for maybe half an hour, 45 minutes, that's how it feels. It feels tired. Yeah, so I'm avoiding a lot of front exercises. I'm not trying to do too much of them. And if I do them, I'll work on my back pretty heavy. I do a lot of rows because that's what I've been doing in physical therapy too. They said you have to do rows. You got to keep your shoulders back, and also this is important, especially if your injuries in the front. To keep your shoulders back, and you got to maintain that posture. What else? Yeah, for the most part, that's pretty much it. Good luck with your recovery. Just remember, be patient. Listen to your physical therapist, and yeah, just take care of yourself and don't push it too hard. If you're gonna lift weights, just lift lightweight and increase it incrementally. And if you feel any pain at all, just stop. Just literally stop. Go home, and one day at this stage isn't gonna do anything to you. If whether you work out for one day or not, it's not gonna really change much for your physique anyway. So, but one day of doing something wrong can literally ruin your life, or it could pretty much ruin the whole surgery. So just be patient. Stay tuned for my next video. I'll probably make a video in 2 weeks, or maybe 1 week. I don't know. I'll see. But yeah, I'm just gonna keep documenting my progress. Hopefully this helps. Hopefully my advice helps you. If you have an injury to your shoulder, don't do what I do and wait years. Just go to a doctor. Well, this is important. Make sure you go to someone who specializes in shoulders or sports injuries. You don't want to go to your primary healthcare doctor, because for me, I went to one about 7 years ago, and I told her my shoulder hurts. It's in bad shape. She literally just told me, go like this, go like this, go like this. Just stupid movements, and I did all those. She's like, "Oh, your shoulder's great. It's fine. It's probably nothing serious. Just go." And she prescribed me physical therapy for 2 weeks. Or 2 months. And in my head, I knew there's absolutely no way physical therapy can fix my shoulder. There's absolutely no way. And then fast forward several years, I go to a surgeon. I found a surgeon who's specifically works on shoulders. So I go to him. He tells me to do, same thing, do some special movements. He bends my arms in a little way, and he tells me, tell me if you feel pain here or feel pain there. I tell me I feel pain here. I don't feel pain there. And he goes, yeah, you probably have a labrum tear. And he tells me to go downstairs to get MRI. I get the MRI. He goes, yep, you have a labrum tear. So that's the difference between someone who knows what they're doing and someone who who doesn't specialize in sports injury or shoulders. So that's really important too. Don't go to your doctor that you've been going to for the past 5 years for like colds or the flu or something. They're not gonna know what to do. Yeah, that's it. Good luck with your recovery. I'll see you next video.